The Sustainable Development Goals (SDG 3) seeks to ensure healthy lives and promote well-being for all at all ages. The first health target of SDG 3 is to reduce the global maternal mortality ratio to less than 70 per 100,000 live births by 2030.
Our strategic plan that we are running currently is from 2021 to 2025, and our objective is to reduce the burden of malaria disease by 50% by 2025. And then reduce death to near zero death.
Malaria during pregnancy is a major preventable cause of maternal and infant morbidity and mortality in epidemic regions of sub-Saharan Africa.
Another preventive measure we are also doing is intermittent preventive treatment for pregnant women, where all pregnant women are to take a certain medication after 16 weeks. They take it every month till they deliver, so we'll make sure that they or the child who is yet to be born doesn't suffer from malaria.
As reported in the 2013 Malaria Journal, malaria during pregnancy compounds or provokes anemia, which when severe increases the risk of maternal death, estimated at around 10,000 deaths annually.
You know, in communities like this, people will keep the sick child at home for many days. But when the community health nurses are visiting the households, they can pick up the cases of malaria and be able to test and treat the child early so the child does not develop complications.
Low birth weight linked to around 100,000 annual infant deaths in Africa. Preterm delivery, congenital infection and reproductive loss are also linked to MIP. Current recommended MIP prevention and control includes intermittent preventative treatment, IPTP, distribution of insecticide-treated bed net, and appropriate case management.
Over years now, Ghana has had several mass distribution campaigns for insecticide-treated nets, mosquito nets for short. It's interesting. Human behavior and behavior change, it takes time to begin with. And sometimes there are other factors that influence people's behavior. It is true that not all the nets that have been distributed are being used and used appropriately or used rightly. Right use of mosquito net means sleeping in the net every night. I mean, not even on hot nights should you sleep outside the net. So this is work in progress.
It is estimated that although 73% of households own at least one ITN, usage rates were noted to be lower. For instance, net use among pregnant women and children under 5 is 52% and 50% respectively.
So yes, we do distribute nets, and we've always had the net use lagging behind those who own them. Most people who have the nets will use, but quite a significant number also don't use, and that's worrying, because until you use the net, you won't benefit from the effect of the net. So I'm happy at times to get the media asking this question, because to get people to use the net, you need to empower them with information. So working with the media, using other means of sending information to the people in the country is key in getting people to use the net as they sleep in it. This year, we are distributing nets to a huge number of people in the country through the mass campaign. So we'll continue our efforts in giving them the right information for them to understand that if you have the net, sleep in the net to prevent the mosquitoes from biting you at night.
With 3% of global malaria cases and deaths, Ghana is among the 15 highest burden malaria countries in the world. Ghana reported the highest increase in absolute case numbers, 500,000 new cases from 2017 to 2018, which represent a 5% increase versus 2017 levels from 213 to 224 per thousand of the population at risk. In comparison to 2015 levels, cases rose by 3% from 217 to 224 of the population at risk.
So I think one of the challenges that is coming up is the gap in our funding. Yes, malaria is a disease that we need a multi-pronged approach. So you realize that we are doing a number of different things, tackling the parasite, tackling the vector, tackling the breeding side to get rid of this disease. Unfortunately, that requires a lot of resources. That's a major gap. We are hoping that domestically we'll be able to fill that gap. And also getting people to finish their medication when they are not well is difficult, you know. The ACTs, which is the short form of the artemisinin-based combination therapies that we use for uncomplicated malaria, is very effective. So sometimes after taking the first dose, people feel better, and then they don't finish the third dose, and that's something that we want to tell people to stop doing it, to desist from that, and try and finish your full dose for the 3 days.
For World Malaria Day in 2021, so generally for some years now, the theme for malaria control has been Zero Malaria Starts With Me. That has been the campaign. But this year specifically, the theme is Draw the Line Against Malaria. And we want the message to go out there that every person, every individual has something to do to create a malaria-free community. You can draw the line by your sleeping in a mosquito net. You can draw the line by getting tested early. You can draw the line by ensuring you get the right treatment when you have malaria. So together we can all draw the line against malaria. Malaria will stop with us and would not be able to pass on to the next generation.
So my message is that, you know, getting malaria down starts with each of us. That's why our theme is Zero Malaria. We have to draw the line against malaria. Sometimes we keep saying malaria is normal, it's been with us for ages, can we ever get it down? But we brought death down, we brought prevalence down, so we can all do our part to make sure that malaria is eventually eliminated. And I think it's possible. Let's all put our hands on deck. Let's embrace the preventive measures that are there for us, and if we happen to be sick, let's get tested and treated appropriately so that eventually we can all get malaria away from Ghana.